The two sides are getting closer to an agreement, but the fact is this strike still wears on, affecting nearly 15,000 nurses and far, far more of their patients. Days into the fourth week of the nurses' strike, picket lines at multiple hospital sites continue, but there's one change after all this time, and it's major.
Hope. We have hope.
That's a word that has not been said on a picket line since the strike started on January 12th. But nurse Roy Permal, who's been in contact with the contract negotiating team, also warned about getting hopes up too high.
We just can't back down because we have a little glimmer of hope, because this is just going to drag on, and we can't drag this on. We have to finish these negotiations. He's
talking about the result of negotiations that went well past midnight Tuesday morning. All of the hospital systems involved, New York Presbyterian, Montefiore, and Mount Sinai, made new offers to the New York State Nurses Association, or NYSNA, the union. But it said on Tuesday, in part, quote, the hospitals returned proposals that were inadequate and failed to offer a clear path to return nurses to work, unquote. It said the hospitals did not address safe staffing in their offers, so the strike continues. Nurses like Natalie Zhao say they're fighting, but she also relies on a prescription for parts of a breathing apparatus for a medical condition.
And I'm not allowed to reorder my supplies because of no insurance. How long can I push this off for?
They get no pay and no insurance while they're on the picket line. The union says it needs to see more nurses per work shift, no reduction in health insurance packages, and increased safety on the job, as well as higher pay.
The patients know us. They know we take good care of them. The hospital should take good care of us.
So negotiations continue. How soon might they result in a new contract remains an open question, but we will stay on this situation up to the minute, as always.